Олена Москалева. Hello, Mrs. Smith. I'm Nurse Elena. Can I be a nurse today for assessment?
Yes.
Can I share your findings with your family?
Yes.
Thank you. Vital signs. You have hypertension today. Blood pressure is 167/100. Respiration is 20 breaths per minute. It's a normal range but high border. You have tachycardia at 105 beats per minute, probably due to the pain. Temperature is 37 Celsius. It's a normal range. Do you have chest pain?
Yes, upper chest pain, 5 out of 10.
Abdominal pain?
Yes, stomach ache right here, 8 out of 10.
Do you have a history of GI or cardiac problem?
Yes, high cholesterol and high blood pressure.
Are you dizzy today?
No, I feel tired.
Do you have edema?
No.
Irregular heartbeats?
I think it's fast right now.
Do you drink alcohol?
A glass of wine sometimes.
Do you feel nauseated or vomiting?
Yes, I did vomit once.
Do you drink coffee?
1 coffee each day.
Do you take medications?
Yes, I take a bunch. I have type 2 diabetes and high blood pressure.
Do you have allergies?
No.
Thank you. At this point, I would do OPQ-ISTU pain assessment. So my patient appeared fatigued today. I don't see any edema. I don't see any jaguar vein distension. A patient behaving normally. I don't see any dyspnea. No cyanosis around the mouth. Skin color is matching her ethnicity, and I don't see any pulsation around the chest area. We'll check pulse. We'll start with a carotid pulse at the neck. Then brachial pulse bilaterally, radial pulse bilaterally, and dorsalis pedis pulse bilaterally. A cup refill on fingers less than 3 seconds normal, on toes less than 3 seconds normal. Now we'll check for S1, S2 heart sounds and for murmurs, starting with aortic area at the second intercostal space. At the right side of the sternal border, pulmonic at the second intercostal space, left side of the sternal border, Erb's point at the third intercostal space, left side of the sternal border, tricuspid valve at the fourth or fifth intercostal space, left side of the sternal border, mitral at the fifth intercostal space, mid-clavicular line, left side of the chest. Now I will listen with the bell at exactly same points. Aortic, pulmonic, Erb's, tricuspid, mitral. I didn't hear any S3, S4, so no murmurs, what usually sounds as a whooshing, but I heard S1 and S2, what sounds as a normal. Now I will listen for a full minute at the apical pulse located at the fifth intercostal space, mid-clavicular line, left side of the chest for a full minute. Patient has 70 beats per minute, what is normal. Usually it's checked before administering digoxin or if radial pulse is weak or irregular. Now I will check abdomen. I don't see any bruises, any scratches on the abdomen. Patient has no jaundice. I don't see any rashes, any lumps, any bumps. The umbilicus is midline. The contour is flat. I don't see any distension, and I don't see any pulsation around the abdomen. So we'll do auscultation starting with a right lower quadrant abdomen, and we will go in a clockwise manner. So right lower quadrant abdomen, you have appendix. Right upper quadrant abdomen, you have liver and gallbladder. Left upper quadrant abdomen, you have stomach, and you have spleen. Left lower quadrant abdomen, you have descending colon. Patient has normal bowel sounds as between 5 to 30 sounds per minute. Now we'll start with the indirect percussion using the finger, starting with the right lower quadrant abdomen, and we will move in a clockwise manner. I will hear tympani at the stomach and intestine, and I will hear dullness at the liver and solid organs. So we'll do palpation with one hand using 3 or 4 fingers, starting with the area away from the pain. So we'll start with the lower left quadrant abdomen. Moving my fingers with a slight depression is a 1 to 2 centimeters in a circular motion, and it will be clockwise manner, and I will finish with the most painful area. Hello, doctor. This is Nurse Alana. We have Mrs. Jane Smith today, 63-year-old patient admitted with a chest pain radiating to shoulder, rated as an 8 out of 10. Abdominal pain at the epigastric area, rated as a 5 out of 10. Patient had nausea and vomiting after breakfast. Patient has type 2 diabetes, high cholesterol, and high blood pressure, family history of myocardial infarction. She is hypertensive. Today's one, the blood pressure is 167 over 100. She has tachycardia 105 beats per minute, probably due to the pain. Temperature 37 Celsius normal, and respiration 20 normal, slightly elevated maybe due to the pain at this higher border. I think patient had no cyanosis during assessment and no edema. Bowel sounds normal, and S1 is 2 present, no murmurs. Patient needs urgent assessment by MD to rule out cardiac event. I think she might have myocardial infarction or unstable angina. She might have GERD as well. As a nursing intervention, I'm going to move the bed into the semi-follower position to relieve chest pain. I will start IV access for urgent intervention, and I will closely monitor blood pressure because she's hypertensive, and check her heart rate just to catch any cardiac distress. I expect a physician to order urgent ECG, urgent blood work for cardiac enzymes for troponin test to rule out myocardial infarction, a proton pump inhibitor to relieve pain at the epigastric area, maybe for GERDs, and to prescribe antiemetics for nausea and vomiting. Thank you, doctor. Thank you, patient.